10 common symptoms you should never ignore could be cancer. Your body is constantly sending you messages, but are you listening? Right now, millions of people are ignoring warning signs that could save their lives. These aren't dramatic symptoms that send you rushing to the emergency room. They're subtle changes that seem harmless, but could be your body's way of telling you something serious is happening. Today, I'm going to share 10 common symptoms that many people dismiss as normal aging or stress, but could actually be early signs of cancer. Catching cancer early can mean the difference between a full recovery and a life-threatening diagnosis. Let's dive into these warning signs that could save your life. Symptom number 1. Persistent fatigue that doesn't improve with rest. We all get tired, but cancer-related fatigue is different. It's a bone-deep exhaustion that doesn't go away even after sleeping for 8 or 9 hours. This happens because cancer cells steal nutrients and energy from your healthy cells. Cancer fatigue also comes with a feeling that your body is working harder than usual to do simple tasks. Walking upstairs might leave you breathless, or you might need to sit down after making your bed. Leukemia, colon cancer, and stomach cancer often cause this type of persistent fatigue months before other symptoms appear. If you've been unusually tired for more than 2 weeks without an obvious cause like stress or poor sleep, don't ignore it. The key difference is that normal fatigue improves with rest and good sleep. Cancer fatigue gets worse over time and interferes with your daily activities. Symptom number 2. Unexplained weight loss. Losing weight without trying might sound like a good thing, but it's actually one of the earliest signs of several cancers. When cancer cells grow rapidly, they use enormous amounts of energy, causing your body to burn through calories even when you're not active. Pancreatic, stomach, lung, and esophageal cancers commonly cause weight loss before any other symptoms appear. The weight loss is usually significant, about 10 pounds or more over 3 to 6 months without changes in diet or exercise. Your clothes might start fitting loosely, or people might comment that you look thinner. You might also notice that you're not hungry as much as usual, or that food doesn't taste as good as it used to. This happens because cancer can change your metabolism and affect hormones that control hunger and appetite. If you've lost more than 10 pounds without trying, see your doctor within 2 weeks. Symptom number 3. Changes in bowel or bladder habits. Your bathroom habits might seem embarrassing to discuss, but changes can be important warning signs. Colon cancer often begins with subtle changes in how often you have bowel movements or what they look like. You might notice that you're constipated more often than usual, or that you have diarrhea that lasts more than a few days. The shape of your stool might change too. It could become very thin or ribbon-like if a tumor is partially blocking your colon. Bladder cancer can cause changes in urination. You might feel like you need to urinate more often, especially at night. You might also feel burning or pain when urinating, or feel like your bladder isn't completely empty after urinating. Blood in urine or stool is always concerning and should be evaluated immediately. But even changes without blood can be significant if they persist for more than 2 weeks. Symptom number 4. Persistent cough or hoarseness. A cough that won't go away is one of the most common early signs of lung cancer. This isn't the cough you get with a cold that improves in a week or 2. Cancer-related cough persists for weeks or months and often gets worse over time. The cough might be dry, or you might cough up small amounts of blood or rust-colored phlegm. You might also notice that your voice becomes hoarse or raspy and stays that way for more than 2 weeks. Lung cancer can also cause chest pain that gets worse when you cough, laugh, or take deep breaths. The pain might feel like a dull ache or sharp stabbing sensation in your chest, shoulder, or back. Even if you've never smoked, persistent cough and hoarseness can still be signs of lung cancer. About 20% of people who develop lung cancer have never smoked tobacco. But here's a symptom that surprises most people because it seems completely unrelated to cancer. Symptom number 5. Skin changes and new growths. Your skin is your body's largest organ, and changes in your skin can signal problems inside your body. New moles, changes in existing moles, or growths that bleed, itch, or don't heal are obvious warning signs of skin cancer. But other skin changes can indicate internal cancers. Yellowing of the skin and eyes, called jaundice, can be an early sign of pancreatic, liver, or bile duct cancer. This happens when cancer blocks bile ducts, causing bile to back up into your bloodstream. Darkening of the skin, especially in skin folds like your armpits, neck, or groin, can sometimes indicate stomach, lung, or uterine cancer. This condition is called acanthosis nigricans, and it's caused by insulin resistance that can accompany certain cancers. Persistent itching all over your body, especially without a rash, can be a sign of blood cancers like lymphoma or leukemia. This happens because cancer cells release chemicals that make your skin itch. Check your skin monthly and take photos of any suspicious spots to track changes over time. Symptom number 6. Difficulty swallowing or persistent indigestion. Trouble swallowing, called dysphagia, often starts subtly. You might notice that food feels like it's sticking in your throat or chest, or that you need to drink more water to wash food down. This can be an early sign of esophageal or throat cancer. The difficulty usually gets worse over time, starting with solid foods and eventually affecting liquids too. Persistent indigestion, heartburn, or stomach pain that doesn't respond to over-the-counter medications can indicate stomach or esophageal cancer. This is especially concerning if you've never had digestive problems before, or if the symptoms are different from your usual heartburn. You might also notice that you feel full after eating very small amounts of food, or that you have nausea and vomiting that comes and goes for weeks. Stomach cancer is often called silent cancer because early symptoms are easily mistaken for common digestive problems. Don't ignore persistent digestive symptoms that last more than 3 weeks. Symptom number 7. Unusual bleeding or discharge. Any unexpected bleeding should be taken seriously. For women, this includes bleeding between periods, after menopause, or unusually heavy periods. These can be signs of uterine, cervical, or ovarian cancer. For men and women, blood and stool can appear as bright red blood, or stool might look very dark and tarry. This can indicate colon, rectal, or stomach cancer. Unusual vaginal discharge that's bloody, watery, or has a foul odor can be a sign of cervical or uterine cancer. Any nipple discharge, especially if it's bloody or happens without squeezing, should be evaluated for breast cancer. Coughing up blood, even small amounts, can indicate lung cancer or other serious lung problems. Blood in urine, which might make urine look pink, red, or cola-colored, can be a sign of kidney or bladder cancer. Don't assume bleeding is due to hemorrhoids, heavy periods, or other benign causes without getting proper medical evaluation. Symptom number 8. Lumps or swelling. Finding a lump can be frightening, but not all lumps are cancer. However, any new lump or swelling that doesn't go away after 2 weeks should be examined by a doctor. Breast lumps are well-known warning signs, but lumps can appear anywhere on your body. Check your neck, armpits, and groin regularly for swollen lymph nodes, which can indicate blood cancers or cancers that have spread. Testicular cancer often presents as a painless lump or swelling in one testicle. This cancer most commonly affects men between ages 15 and 35, and it's highly curable when caught early. Thyroid cancer can cause lumps or swelling in the neck, along with difficulty swallowing or changes in your voice. The good news is that most thyroid cancers grow slowly and are very treatable. When checking for lumps, use firm pressure and move your fingers in small circles. Compare both sides of your body to notice differences. Symptom number 9. Persistent headaches with other neurological symptoms. Headaches are extremely common and usually harmless, but certain patterns can indicate brain tumors. Brain cancer headaches often occur with other neurological symptoms like vision changes, difficulty speaking, weakness on one side of the body, or personality changes. These headaches might be worse in the morning or wake you up from sleep. They often get progressively worse over weeks or months, and they might not respond well to over-the-counter pain medications. Seizures that start in adulthood without a history of epilepsy can also be a sign of brain cancer. These might be subtle, like brief episodes of confusion, strange sensations, or involuntary movements. Memory problems, difficulty concentrating, or changes in personality that family members notice can also be early signs of brain tumors. These symptoms develop gradually and might be mistaken for stress or aging. Symptom number 10. Fever and night sweats. Frequent fevers without an obvious infection can be a sign of blood cancers like leukemia or lymphoma. These fevers often come and go over weeks or months, and they might not respond to fever-reducing medications. Night sweats that soak your pajamas and sheets, requiring you to change clothes or bedding, can accompany blood cancers. These aren't the mild sweating you might experience in a warm room. They're drenching sweats that wake you up. You might also notice that you get infections more frequently than usual, or that minor cuts and scrapes take longer to heal. This happens because blood cancers affect your immune system's ability to fight infections. Bruising easily or having small red or purple spots on your skin can indicate problems with blood clotting, which can be a sign of leukemia. When to see your doctor. The key message here is that cancer often starts with subtle symptoms that are easy to dismiss. Most of these symptoms have benign explanations, but it's important to get them checked if they persist for more than 2 weeks or if they're different from what's normal for you. Keep a symptom diary noting when symptoms occur, how severe they are, and what makes them better or worse. This information helps your doctor determine what tests might be needed. Remember, finding cancer early dramatically improves treatment success. Many cancers that are caught early have cure rates of 90% or higher. Don't let fear keep you from seeking medical attention. Most people who have these symptoms don't have cancer, but for those who do, early detection can save their life. Which of these symptoms have you been ignoring? Your body is trying to communicate with you. Make sure you're listening. If this information could help someone you know, please share this video. Early detection saves lives.